comorbidities are an important part of treating patients with psoriasis, because when you're treating patients, you're looking at the patient as having a systemic disease, especially patients with moderate to severe psoriasis. What we know from looking at the United Kingdom General Practice database is that patients with psoriasis have an increased risk of heart attacks, especially severe patients and men have the highest risk. And we also know from this database that patients with psoriasis live 6 years less than the general population. So we found out that it's mostly due to these cardiovascular events. They're called MACE events, major adverse cardiovascular events. And we know from the past treatments that we've used, such as methotrexate and folic acid, that we can actually reduce those cardiac events. We also have some emerging evidence that some of the newer treatments we have, the biologics, can also reduce these major adverse cardiac events. So we have a study that was published out of a Danish study that was published in 2013 where they looked at 2,400 patients with severe psoriasis, and they found that the patients that were treated with biologics, about 80% with TNF-alpha antagonists and 20% with IL-12/23 blockers, had a 70% reduction in their major adverse cardiac events versus only 35% with methotrexate versus topicals alone. We also have a publication that came out of Kaiser that showed that there was a 50% reduction in major cardiac events over a 4-year period compared to topicals alone. And we also know from the SOLAR registry that there's a reduction in the cardiac events that's almost about twice as much in the biologic group versus the non-biologic group. We also have some data to show that we actually could improve survival of our patients with psoriasis, because there was a paper that was published by Burbmeister in the Annals of Rheumatic Diseases in 2012 that looked at all patients that were treated with adalimumab over a 12-year period. They found that the psoriasis patients lived as long as the general population. So I think that we have a lot of new emerging evidence that the treatments we're doing can reduce this really severe comorbidity that patients are really faced with. There's some other comorbidities that I'd like to talk about that I think are important. We know that patients are prone to a condition called metabolic syndrome. And psoriasis patients have about a 6-fold increased chance of developing metabolic syndrome. And metabolic syndrome is a pro-inflammatory state. So what you see in those patients, they tend to have larger BMIs, they're overweight or obese, and they are characterized by having a lot of inflammation. So the fat cells actually don't just store fat, but they actually cause a lot of inflammation and inflammatory cytokines like TNF-alpha, which increases leptin levels and decreases adiponectin levels. And this causes an increase in CRP and IL-6 levels, which cause a lot of inflammation, and patients are more insulin resistant, so they can develop diabetes over time, and they have an increased risk of heart disease as well. So we actually have some studies to show that some of our new treatments can actually reduce some of these treatments. For example, there was a study that was published in the Journal of Gastroenterology in 2013 where they looked at a TNF-alpha antagonist compared to PUVA treatments in patients with metabolic syndrome, and they actually found that the patients treated with the TNF-alpha antagonist were able to improve their metabolic syndrome. So I think we have some good data. There's also depression, which is very interesting. Patients with psoriasis have an increased amount of depression, anxiety, and suicide. And we know that this correlates with the severity of the disease. Now, we always thought that because it's such a visible disease that, of course, if we treat their disease and they get better, their depression would improve. But we're actually finding with new studies that their depression improves before their skin even gets better. So we're thinking that maybe there's a metabolic reason that's causing the depression in these patients. And there's been some interesting studies in the psychological literature that looked at TNF-alpha in patients who didn't have inflammatory diseases. And they found that depressed patients had an increase in TNF-alpha. And when they treated them with antidepressive medications like SSRIs, the depression actually improved over time in these patients. So we're looking at actually TNF-alpha as a possible cause for depression in patients.